There is another meeting happening for our district.
All right, we are live.
That Manning might be on.
He is.
Yeah, it's on my other thing, but I'm with you guys.
Yeah, I was just on that. I jumped off to get on this meeting. They're going to be going for a while. They just started doing the questions and the surveys, so they'll be on for a while.
That's what I'm saying. He might be in that. So
I texted him if he could join. That's great. If not, I mean, we still have a quorum. All right, he said he's going to log on in a couple of minutes, but we'll get started. So, Larry, we're live.
Yes.
Thank you very much. Good evening, everyone. I'm going to call the Health and Public Safety Committee meeting to order. The time is now 7:02 p.m. We have with us, do you mind if I do, you want me to do call or just announce the council people that are on? Is everybody okay with that? All right. We have George Sirenides, myself as acting chair tonight. Councilwoman Shanahan, Councilman Keegan, Councilwoman Johnson, and Councilwoman Revolus with us tonight. First order of business, let's see. Who would like to approve the minutes of January 28, 2021? Thank you, Ms. Shanahan. Are there any additions, abstentions, corrections? Seeing none, all in favor? Passes unanimous. Thank you. Public participation. Larry, do we have anybody that logged on to speak tonight?
No, we have no one. No one's on.
Okay, thank you. Has anyone heard from any constituents or residents that had anything to add to tonight's meeting? Mr. Keegan.
Yeah, Judge, Chair Serenides, do you want me to talk about the email we got earlier when Deputy Chief Zecca gives her?
Let's save that to the end for the discussion.
Okay.
We'll put that on the end as discussion. Okay. All right, so on to new business. I'm going to put item 1A and 1B together since they're essentially the same thing. So item 1A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from Ledge Light Health District in the amount of $51,580 per fiscal year for the period beginning July 1st, 2020 through June 30th, 2024 for public health emergency preparedness. Item 1B, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement the public health emergency preparedness grant for the period beginning July 1st, 2020 through June 30th, 2024. Would anyone like to move that? Anyone? Thank you, Ms. Sheehan. Thank you, Ms. Shanahan. All right, let's open it up for discussion. Deputy Chief, are you gonna speak on this item, or sorry?
It's health department. It's ours.
You're up.
All right. So this is we've been getting emergency preparedness funds every year. It originates from the federal government, from the CDC. It goes to the Connecticut Department of Public Health, and then Ledge Light Health District is a health district that serves as the fiduciary for Region 1. So this is related to the Demis regions. So us and several other local health departments receive funding directly from Ledge Light Health District to carry out our emergency preparedness and planning activities. We use this funding to support our 2 part-time emergency preparedness staff members, our emergency preparedness coordinator and our volunteer coordinator. And so these 2 have been instrumental in responding to the pandemic, and they're instrumental in running and managing the emergency response team, coordinating all the volunteers, doing all the logistics, or getting vaccine clinics. And so so this funding allows us to have those 2 staff members to support our efforts in Norwalk. And this is a standard agreement that's given to all the local health departments that are receiving the funding for this work.
Yeah, that's great. I mean, especially in these times, every grant dollar that we can get our hands on is very much needed and helpful. Any questions from any of the committee? Mr. Keegan.
Yeah, hi, thank you. Deanna, is Ledge Light the health agency that takes care of what you do down here up in like New London, Groton, et cetera.
Correct.
So are they a government agency?
So there's two types of health departments, well, three actually. There's part-time health departments, full-time municipal health departments, and then health districts, which are regional entities. And so they also enforce, the state statutes, and they can have their own local codes, but they are a governmental organization, but they're separate. They have a board of health that actually manages and governs their operations, unlike, in Norwalk, where we have the council and the mayor, governing. That we report to. So they are a governmental agency that represents, the towns that are within their district and provides the public health services for those communities.
Okay, my only concern was that, I mean, I usually read through these things. It was pretty confusing, but that answers one of the questions I have. And this is something you're okay with. This is a standard contract that you're familiar with, and it's good.
Yep.
Okay, thank you.
All right. Ms. Revoluz.
You guys are doing a great job, but with all this grant money and what I was sent this morning, Norwalk has started, with my plight about educating the community in a more nutritional way. You guys do have a site, you're doing well, but is any of that grant with these people pushing any of that to be not just online, but get people like visibly in their face so they can then gear to the online? Because you guys do have great information about like boosting immunity, eating healthy restaurants, so on and so forth. So can we like make that something more public with these new people coming on, especially with this money like this? Does it work anywhere in that,
So that's a great question. So the work that you're referring to that's been conducted in the health education, health promotion division of the health department, it doesn't usually come from the preparedness staff. So there are existing staff that have been on staff working. Their work is more like logistics and coordination and planning and managing volunteers. The work you're referring to would be more of the like the staff within the health education promotion, or potentially nursing staff, so a separate part of the department.
Okay, I thought it would be a part of their logistics to execute. Does that make sense?
So you're talking about like as you're out there in the community delivering vaccines or whatever, if we're responding to emergency, would we be doing that, like pushing out that messaging with that staff? Yeah.
Right. That's what I meant. Mm-hmm. Like if they're married together.
Yeah.
Yeah.
So yeah, I see what you're saying. Sort of like maybe even thinking about the emergency response team volunteers and some of that. That's
right.
It's a good,
right.
Good thought, good idea. Yeah.
Right. Thank you.
Any other questions?
Well, it's going to be tried though. Maybe it'll be brought up.
We don't have any immediate plans to do that right now because we're so focused on just getting the logistics of these sites in place, but certainly something I could bring back to my team and think about, in the future. But, I can tell you a little bit more on the updates about, where we are with the vaccines and our planning right now and the immediate plans. I can certainly take that back to the team.
Yeah. Okay. Thank you.
Yes, Ms. Johnson.
Thank you. Deanna, I noticed from the materials there are going to be programmatic progress reports and financial expenditure reports, all that sort of thing on a specific timeline. And you will have visibility for that, right? That's part of the contract, is that you're going to be able to monitor progress and adjust accordingly, I assume?
Correct. Awesome. Yeah.
Great. And does that come to us at any point, or is that just like
usually it just goes directly, it goes to the state health department because they're the ones overseeing and monitoring the activities.
Okay.
But we do have lots of grant reports.
I know. I can imagine. Thank you. Thanks for that piece of information. Appreciate it.
Okay. Any other questions? Don't see any. All right. All in favor? All right, it's unanimous. Thank you very much. Now it's on to discussion items. We're going to start off with the fire department because that's first, and then Tom, when we get to the police department, we'll go into that email that you got. So, Chief Gatto, you're up. Anything new to tell us about the fire department?
Oh, we have a lot going on.
Never a dull moment.
Thank you, and good evening to everybody. So I'm just going to run through some of the calls that we had for the month of January. 502 calls, which averages to be 16.2 calls per day. And we break it down into subcategories, 15 different kinds of fires, 32 rescues. We had 282 emergency medical responses, 24 hazardous conditions, 20 public assistance calls, 42 smoke scares, and 85 alarms, for a total of 502. And just quickly, we had January 4th, bedroom fire on Ryan Avenue. On the 5th, we had a garbage truck fire. So the way garbage truck fires work is if a garbage truck catches on fire, they have to dump their load in the middle of the road. So it's a good time after that.
That's got to smell great.
Yeah. We had three different car fires. We had two extrication, motor vehicle accidents and extrications. And we had one brush fire in Hunter's Lane. So those are the calls for the month. One thing I want to bring to your attention is we're beginning to start our smoke detector program again. So we just purchased 40 smoke detectors, and what we're doing is we're each apparatus is carrying, a few smoke detectors, and if they go to a call and they find that the residence does not have any smoke detectors, we will drop one off for them so that they could have it installed and have a working smoke detector. The fire marshal's office had 69 inspections. They sent out 37 new notifications. There are 12 plan reviews. There were 7 liquor licenses. So the revenue brought in was $1,055. They did 4 fire investigations. What's that? Okay, so the next thing is I want to just keep you updated on the firefighter entry level exam that we're going to be giving. So we've been working with the vendor, Morris McDaniel. We're going to, we hired this this company is going, it's called Firefighter app. The police department uses the police app. We're going to be using Firefighter app for the candidate to, go online and sign up and register to take the test. And right now we're working to develop the postcards and the posters and the wording that we're going to use on the websites, et cetera. And we're tentatively looking at an April 24 written exam date, but that still could change. And then lastly, on the COVID front, we really are doing very well as far as that goes. We only have 2 members that are out that tested positive a few months ago, and they're still out. But there are no new cases lately. So that's about it for the fire department. Questions?
Chief, that's great to hear, especially with the firemen living in such close proximity.
Yeah.
It's good to see that you guys have taken the precaution and the safety measures, and we're not having a bad case of COVID going through the fire department. As far as the test goes, I'm sorry, guys, if anybody has questions, I'm not going to hog up all the time. But As far as the test goes, I heard we have quite a few candidates ready, and it's starting from fresh from the beginning, right? None of the whatever happened in the last test around. Everybody's going to get issued a whole new test from the beginning.
Right, right.
And
Let's
the
make
company
believe,
we're
let's make believe that never even happened.
perfect.
So we're starting off fresh.
The company we're using, any other neighboring cities or towns use the same company? Do you have experience with them?
They did New Haven. New Haven used them. And I believe another town in Connecticut. I can't remember. Could be New Haven, but I'm not sure which one.
Okay.
So, but they've been around for 40-something years. So they're good company.
Great. Any questions, Ms. Shanahan?
I'm just interested on how things are going with your COVID vaccination of the firefighters. Are you in pretty good shape on that, or are people volunteering to get the vaccination?
Well, I wish we had more people that are willing to take the vaccine. We're probably a little more than 50% of the department. And then you break that other 50% down into who wants to wait a little while and then who doesn't want it at all. So I just sent out another email to everybody today about the CDC allowing people that have been vaccinated, and if they get exposed, they don't have to quarantine. So I was, trying to get everybody to understand that, and that, hopefully they will sign up now and get vaccinated. So I'm hoping little by little, the guys will come around, but we're not 100% yet.
Any, Ms. Johnson?
Again,
Oh,
so
sorry.
sorry, but this is why nutrition again. I hate to sound like a broken record, but I will be the broken record. It's one thing you guys are doing is eating together. And if you are having those delays, the conversation about healthier eating, nutrition, boosting immunities, having tea, certain things would be helpful for those who are delayed or have apprehensions towards it. I don't mean to sound like, again, it would just be informative for not only your team, but our community.
Well, we do have a trainer and a nutritionist that comes in weekly to talk to whoever wants to be spoken to, and that's part of the subject that they're talking about.
Yeah, I think like you, especially you guys as a community, as a family, that conversation about the nutrition within too, eating holistic, I think would probably come over as a family. Families eat together, you know what I mean? That's what you guys are. So it would just mold over a little bit, and preparating what we're holding it on ourselves while we're when we have to go somewhere, whatever. It just, if it becomes routine for you, when you do go home to your families, it'll become routine for them, so on and so forth. But
right.
Yeah.
Good or bad, meals are always a big topic in the firehouse.
Right. That's family. We want to eat.
They cook breakfast every day and they cook dinner every day.
Right.
Lunch is usually, lunch is usually a takeout. Sometimes
see, even right there. See right there. Takeout. See right there.
Yeah, well,
I'm just teasing you, but you know exactly.
No, yeah, okay.
That's all.
Ms. Johnson?
Just wanted to follow up on Councilmember Shanahan's question about the vaccines. And it sounds like, and if I recall correctly, Chief Gatto, that there is a mandatory quarantine if somebody tests positive, if a firefighter tests positive or EMT. Is that correct?
Well, just like anybody else, but yeah, if you're not vaccinated and you're exposed, you have to quarantine for a minimum of 10 days.
Okay.
If you don't have any tests and you have no symptoms. After 10 days, you can come back to work.
Okay.
They lower that number down to 7 if after day 5 you get a negative test and have no symptoms. Okay. And now, if you have both of your vaccine shots, you're asymptomatic, and it's not more than 3 months since you had your shots, you do not have to quarantine.
Thank you for that piecing.
No.
You can see the benefit of the vaccine there, I think, in that regard, for sure.
Definitely.
Yeah.
Big benefit.
Any other questions for Chief Gata? I don't see any. All right, Chief, thank you very much. Have a
Thank
good
you.
night. Thanks for the update.
Yep, you too. Bye now.
Deputy Chief, you're up. Zeka, how you doing?
Hi.
Oh, Chief.
We're in the process of doing we just did some entry-level interviews. We're looking at not only brand new officers, but also officers that may be certified with other departments. So we're looking to hire some combination thereof, because right now it's not that easy to get seats in the academy. And we are down a few officers, so we're looking to fill those. We have completed interviews, and there were some really great candidates, so we're very hopeful that. Additionally, we're also doing interviews for a couple of civilian positions that had been vacated through in October, when the large group of employees retired. And then in terms of COVID, we also have 2 people out right now, but we've been staying pretty good with that, with not a lot of people out. And we probably are over 50% with vaccines now who've gotten their 2 doses. And pretty much every week there's a few more people coming on board. But we don't get a report of who actually gets the vaccine because it is medical information. So I don't know what our exact percentage is, but we've been doing pretty good so far.
That's fantastic. Again, with so many people in the department, sharing the same areas, it's good to know that we're at least taking all the precautions, keeping everything clean and keeping everybody safe as possible. That's fantastic. Any questions for Deputy Chief Zeka? Mr. Keegan?
Yeah, hi, Chief. A resident of Ingalls Avenue communicated to the entire council, and I know that Councilwoman Revolou and Councilwoman Young from her district did communicate with her. And I spoke to her on the telephone because I'm a telephone kind of guy. So it's basically illegal dumping, and it's been going on for some time, and you guys may even know about it. Is there anything that we can do to help her and her neighborhood with this problem?
The location that I believe you're talking about, I think we have addressed in the past. And if we can put her in touch with our community police officer, we could absolutely see what we can do to look at the problem again.
If you don't mind, I will forward, or Diana, if you'd prefer to do it, we'll forward you her email. And then maybe somebody.
Yep.
Diana.
And we can put the community police officer in touch with her so they can work directly together is the best way for them to evaluate what's going on and how we may be able to help.
Thank you. I'll just defer to her representatives. Thank you.
Councilman Keegan, I appreciate it.
I'm also going to add a little bit more to that. Chief, as you know, we've had problems, like you said, with that particular area in the past. About 3 years ago, when Mr. Chimento was still was the director of Public Works, we ended up putting up a deer camera in that area, and it's always the same. It's always the same culprits that take on odd jobs of cleaning out areas, and instead of paying to dump at the transfer station, they find isolated areas like that where no one's paying attention, and they drop the trash there. 3 years ago, when we did that, we had good results. I think we ended up arresting about 3 different people. Or
I know there were at least a couple.
So Anthony Carr was on that email. He saw what happened, and it's going to come up in our next Public Works Committee meeting as well, so we can discuss it further there. But they're already talking about setting up the deer cameras in that area and other areas within the district the best thing we could do is have residents keep the police department or the community individual, just keep them apprised. Tell them what's going on. If you get license plate, get descriptions of vehicles, and that's the only way we're going to stop them. Because if they get away with it, and a couple times they get away without having to pay to dump at a transfer station, they feel it's going to be easy money, and they'll just keep doing it. So the best thing is to do is to be vigilant. But if we have areas like that that are a constant problem, we're going to set up those deer cameras again through Public Works, work with the police department, and hopefully we'll find out who it is. Yes.
I was just going to second that. In my conversations with the city this morning, that's exactly what they were saying, that there used to be surveillance camera a little further down, and to maybe that being a possibility of surveillance again. But I would really love to see more, like maybe just more vigilance with the employee, because it is a heavy residential, but that area is also heavily wooded and over foliaged and so on and so forth. But just like right here is families, you know what I mean? So it's like, if we can get them to be a little, or just the community to be a little more vigilant, and it's always somebody coming into the area. It's not the residents of the area. So I don't know if it's a double overly surveillancing how they will feel. So maybe if having vigilance within the residency of getting license plates, this and that, and so on. But however and whatever, we don't want any area in Norwalk being junked. You know what I mean? That's not what our residents deserve. But that's exactly what was voiced this morning. So I just want to double back on what you said. There was surveillance out there before that did cause some help, but for some reason right now it's come back.
Where the camera previously was, it wasn't, in anybody's residential space. It was just
beautiful.
really on the problem.
Yeah. Beautiful.
They're not obtrusive. They're not aiming towards residents. It's all about the areas where the dumping occurs, and they're temporary setup deer cameras. So once the problem's resolved, the cameras get taken away.
Remove. Right.
And again, like
doubling
every now and again, like everything else, every now and again, you got to refresh people's memories about how you can't get away with these things. So
this is true. This is true. And it's getting warm. This is true.
So any other questions or comments for the chief? All right. Thank you, Chief. All right. Deanna, you're up again. This is the Deanna show. Let's go.
So the percentage of people that are testing positive for COVID continues to trend down. If you might recall, it was over 10%, in January, but it's now down to the latest is 5.6% for the past 2-week period. So we see both the percentage of people that are testing positive going down, as well as the total case counts that we're seeing. So the case rates are trending down. So we're obviously very happy to continue to see the cases going down. Wanted to provide you some updates on the vaccine so far too. So I want to give you some data on, what the health department has administered so far, and then share some data that the state provides about actual Norwalk residents, because as you know, people in Norwalk can go to other towns and other places to get vaccinated. And, vaccinators aren't just vaccinating people within their own town. So as far as Norwalk Health Department, we've administered 3,000, over 3,000, about 3,100 at this point administered. The state announced changes to their vaccine rollout earlier this week. So there's no longer the frontline essential workers and people's underlying health conditions being included within 1B, and it's now age-based. And so they're opening up to 55 and older starting on Monday, as well as opening up availability for teachers and people that work in education in school buildings, as well as childcare settings. And the state health department has asked local health departments to really help with vaccinating the educators and those in the childcare setting. So they've asked us to put that focus, within the month of March to support that effort. As far as Norwalk goes, as far as February 23rd, I just looked at the latest data from the state. 10,794 Norwalk residents have been vaccinated with their first dose. So that's approximately 12.5% of the population. The state also has provided information within age ranges. So there's about 68% of those over the age of 75 have been vaccinated, and 46.57% of the people between the ages of 65 to 74 have been vaccinated. And if you may recall, it's been about 2 weeks, maybe a little less than 2 weeks for people that have been even eligible if you're 65 and older. So we're seeing, those percentages. I think the state, they reported earlier on this week, the state was about 70% for 75 and older. Some of the cities tend to be a little lower in percentages for the older population, but there's a lot of people in Norwalk that are getting vaccinated, and will continue to do that. The hospital is vaccinating, the community health centers are vaccinating. There are pharmacies now. The state is going to be providing more vaccines to the pharmacies, and they've also are locating the pharmacies in towns that have high social vulnerability indexes in the zip codes, especially considering, where the disease burden has been. So they're trying to strategically put more vaccine within areas that have had the higher disease burden. And those are the main highlights.
That's great. Thank you, Deanna. Ms. Shanahan.
So for those who are listening in, can you give people a little sense of like how one would sign up for a vaccine and, go through that process a little bit?
Sure. So there's actually a great website on the state that lists it all out. There's a lot of different options for signing up for vaccine. The VAM system is the one that the CDC has provided. So there are some providers that are utilizing the VAM system. So there is a link online on the state portal for on the state website where you can enroll if you're eligible based on your age or in your occupation to sign up to get enrolled into the VAM system, and you'll get an email, and then you can create an account, and then you can go look for locations that have available appointments. There's also the Connecticut Vaccine Assistance Line for people that don't have computer access or, don't read English and they need to, so there's other language capabilities if you call the Connecticut Assist Line where they can directly book you appointments. There's also several of the other large healthcare providers like Hartford Healthcare, Yale, Stanford Health. They're not using VAMs, they're using their own scheduling system. So on that state website, there's links to how you can schedule with them. Stanford Health, there is a phone number that you can call. New Vance Health, Norwalk Hospital, they're using VAMs. And then the pharmacies are also directly scheduling appointments. And there's a link on the state website where you can go and see availability based on your zip code, how you can make appointments through the pharmacies like Walmart and CVS and Walgreens.
To your point, Deanna, the process is very user-friendly. I think you guys did a great job. I recently took my parents to get their shots. My father's older. English is a second language. He's primarily Greek, and the facility was quick, on time, and very easy for him to maneuver around. I brought them there, but they went in on their own, and then they got their shot, and it worked out very smooth. They were pleased with it. So they're doing a really good job as far as accommodating and making sure the process is as minimal as possible, which is great. One question that came up and that I wanted to ask you regarding first responders getting their vaccination shot. One of a spouse of a first responder asked, is there a program or a policy where if your spouse is a first responder, whether in the medical field or police or fire, if they get their shot, can the spouse also get a shot because they live in the same residence and possibility of them bringing it home?
No, that's a great question. We got that for some of the healthcare providers too, like spouses or family members of. So no, right now it's just based on your own occupation or your age.
Well, luckily more vaccines coming in, and I heard Johnson & Johnson got approved the other day.
This weekend, they're going to see if they get the final approval, but they're anticipating they will. And if so, then they'll start getting doses shipped to Connecticut, next week.
Great. It's moving pretty quick and hopefully it'll continue to move quicker. Yes, Ms. Shanahan.
General follow-up just for the general public who might be listening. And so Johnson & Johnson is the single dose vaccine, right?
Correct.
And does it look like we might be getting some of that for the month of March, or how do you imagine that would be distributed differently than the other vaccines?
So we haven't gotten definitive plans yet from the state on how they're going to allocate that and distribute it. So we know that it's going to be coming to the state soon, but we're not sure, how what they're going to decide. So more to come on that. But
Thank you. Any other questions? Right. I was just going to make one more comment. Recently, I went to Vets Park to get tested again. Came back negative. If anybody wants to see it, I'm good. But I also wanted to say it was with the added testing facilities, it was great. The long lines are gone. They're not there anymore. Now with I know we have Brian McMahon, we have the college, and there was one other facility. People are going through a lot faster. So we eliminated the long lines. It was a quicker and easier process. So just thank you. So it's fantastic. Shanahan.
Like, while we have everybody's attention, can you just remind us of where those places are and their hours? Is that something easy to rattle off?
Yeah,
so
you're up.
Vets Park and NC Norwell Community College, I'm pretty sure, are still operating 7 days a week. I don't want to give the exact hours. I don't know if I get up off the
8:30
top.
to 4:30.
Thank you. Yep. And then Brian McMahon is scheduled. Semaphore comes and provides, and I believe they're coming this Saturday. I'm not sure about future scheduling, but I know they're coming this Saturday. Smilo Life Center with Norwell Community Health Center, they're also providing testing at that location by appointment. So you can make appointments to go there as well. It's in a great location in the community. So I think that answers the question, right?
There were 4 of them. Yep.
Mm-hmm.
Right. Any other questions? All right. Seeing none, I guess that kind of ends our meeting for tonight. All right, Ms. Shanahan, you're up. Motion to adjourn. She beat you this time,
My
Bob.
favorite motion. Just joking. It's nice to see everybody.
Thank you very much for attending tonight, everyone, and back to the TOD Zoom.
Exactly.
Everyone.
Thanks, guys.
Have a good night.
Everybody,
All right.
thanks for all your hard work.